Hi, I'm Daphne here at the Sync team. Thank you very much for joining us. I'm so happy to say that I've got Liana Poulia here with me. Hi, Liana.
Hi, Daphne.
Thank you so much for joining me. I've been excited to have this conversation with you for some time now, as you know. So I'm really looking forward to getting into some topics and a lot of questions that I've had. Just very briefly to tell our listeners a bit about your background. So Liana is a clinical dietitian and nutritionist at the Laiko General Hospital in Athens, and she's also an elected assistant professor at the Agricultural University of Athens. So, Liana, I guess I really wanted to start just by talking about metabolic health. And I know you and I have spoken a little bit about this, but it's something that, for me has really changed over the last year as I've been sort of reading about it and kind of experimenting with my own health, I guess. And it's really showed me the importance of metabolic health and our metabolism in affecting so many areas of our lives. And it's really changed the way, at least how I think about my nutrition, what foods are healthy, what foods aren't, but also thinking a little bit kind of for the first time, I'd say, about the future as well. And not just, obviously about the impact that having good metabolic health has on our day to day, our energy levels,
Mhm.
and just our cognitive sort of performance, but also on the kind of risk of various chronic diseases. And the more deeply I dig into this, the more I see how many, just
Mhm.
how many different conditions do relate back to metabolic health. And I guess my first question to you is, some time ago, I kind of thought that metabolism is we read all these articles about 5 ways to boost your metabolism, add
And
cinnamon
lose
to
weight.
your tea and lose
Yeah.
weight, exactly. And then that
Mm.
was kind of all that
Yes.
metabolism is connected to. But actually, I just wanted to take a step back and ask you, what is metabolic health? Because it isn't just about how quickly we burn calories, right?
No, actually, we should see ourselves as a big factory, and then in a factory, many things happen. Everything is controlled by our organs, our liver, and actually, metabolic health is the absence of metabolic disease, and this doesn't actually mean something because health is the absence of the disease. But in order to truly understand what metabolic health stands for, is someone maintains his normal body weight, so has a BMI within the normal levels like 18.5 to 25, has normal values of blood sugar, normal lipid levels, and also maintain a physique that is very close to the normality, which is the absence of fat around the belly, which actually is one of the main risk factors for developing metabolic syndrome and metabolic diseases. And metabolic health actually is what minimizes the risk of developing other diseases like type 2 diabetes, hypertension, and cardiovascular disease per se.
Great. And I mean, you spoke there about you referred to type 2 diabetes and hypertension and obesity, metabolic syndrome. I mean, all these things might be something that someone, who's, knock on wood, listening and is healthy, thinking, why should I care about these things? But I think what I've kind of learned is that it's also about, these things don't develop from one day to the next, right? I mean, they are things that are largely preventable following the right sort of
No.
lifestyle and nutrition. So I guess what I'm getting at is, it is a spectrum, right? And it's not that you're either diabetic or you're not. All these things are connected in a way, and I guess maybe you can talk a bit more about insulin resistance, which I think kind of ties all this together. But it isn't just something
Yeah.
that you should worry about if you have been already diagnosed with, as you said, obesity,
Mhm.
hypertension, all these things.
Insulin resistance may be present many, many years before someone becomes diabetic, or you can be insulin resistant without being a diabetic for, for your life. And insulin resistance actually is a situation where you cannot manipulate glucose efficiently in your from your bloodstream. So Your pancreas is increasing the amount of insulin produced without you being able to use it as a vehicle to bring glucose in the cells. Insulin is the key, and glucose is what should go in. So, if we are overweight or obese, or if we lead a sedentary way of life, then we are increasing the risk of actually deactivating our insulin, having insulin resistance. And this is actually the first step of developing metabolic diseases and metabolic instabilities that can lead to metabolic syndrome. And then eventually, if we keep on putting weight, or if we keep on following a diet that it's not the one that we should, or if we keep on being couch potatoes, then eventually we will be diabetic, or we will have an increased risk of cardiovascular disease, even if, since we are young, we don't actually think about the future so much. But when we reach a certain age, we should start actually getting the results of our youth, of our previous life. And we should be very careful what the result should be, and what actually we should expect to see after a certain age.
In your line of work, you must have seen people with prediabetes, right?
Mm-hmm. Let's talk about a bit about prediabetes, because actually it's a situation where we have elevated blood sugar without that being too elevated to be diagnosed as diabetic. And usually it exists before you get a diagnosis for diabetes, and it's absolutely preventable if you do certain changes in your lifestyle and in your diet. Actually, if you find a blood sugar level that it's higher than it should when you're fasted, when you actually haven't eaten anything for 8 hours, you should think that some changes can be done in your diet and in your lifestyle that actually could reverse this situation and bring you back to normal, so that you will actually minimize the risk of having diabetes in the future.
And so when you're talking about bringing it back to normal and reversing it, you're actually talking about bringing your blood sugar levels back into a normal range, because presumably for people in pre-diabetic stage, they are a bit more elevated than they should be.
Mm-hmm. Yes, the normal values for glucose levels when we haven't eaten anything is having a blood sugar below 100, or even less, below 95 milligrams per DL. If we see a value of 100 up to 125, then it means that we're not diabetic, but we are in a pre-diabetic state. And another way to see if something is wrong with our blood sugar is to measure our hemoglobin, our glycosylated hemoglobin, which actually is a marker showing how our sugar fluctuates in 3 months' time. So it's something like a mean, and if that is above 5.7 up to 6.4, it means that the mean glucose in the trimester is a bit higher than it should be, and the mean is something like above 100, which actually put us in the category of prediabetes.
And I think one of the incredible things is that a lot of us might be spiking, let's say, our blood sugar levels without even realizing it. And that can, of course, lead to all sorts of long-term issues, as we discussed, insulin resistance and all of the chronic conditions we discussed. But also in your day-to-day, you might be having several more tangible symptoms that sort of are all connected to that. Can you give us some sense of what someone, continuously spiking their blood sugar and then crashing? Talk us through what things they might be experiencing.
Maybe when we eat a meal and then suddenly we have a craving for sweet. This is one sign.
Happens very often.
Yes, and it's not something like a habit, but it's a real need to eat something more, or feeling sleepy immediately after having lunch, or not being able to function as we should after eating a lunch, or having a problem sleeping. These are some of the signs of having spikes. Uh, Poor sleep can be attributed to a slight hypoglycemia, which actually something our body feels that something is wrong, and we wake up just with the urge to eat something again. And again, the food cravings are coming because we actually cannot regulate the feeding of our cells by having the insulin function and put the sugar in. So our body demands more food, and we want more food to feel the satiety. It's not actually satiety, but it's having our body feel that it is fed. It's something different. We may feel completely full, but again have the urge to eat something, especially something sweet, to cover our needs in sugar and carbohydrates.
And I guess that also stems from the fact that, when I was using now that I've been using continuous glucose monitor, I often see that when I have something that spikes my sugar, it will often then lead to a crash sort of under the initial baseline, let's say, of what it was. So instead of having, one of the things that blew my mind was when I was having oats, breakfast oats and porridge sort of as a healthy breakfast, for you, it might not have the same effect, but for me, for example, it was kind of elevating my blood sugar levels and then making me crash even further down than before I had eaten, which is definitely not what you want when you want to be having, a breakfast that's going to give you a sustained energy levels. And I guess that sort of even more lowered blood sugar levels is also what then causes you to want to sort of crave something sweet or starchy or whatever, because it's actually the case that physically your body wants to bring its glucose levels back up.
Yes, and it's because as we have a spike, this spike is created because our body cannot regulate blood sugar by having efficient insulin. So we keep on producing insulin, and that eventually will function. So it will bring rapidly our blood sugar down, and we will have symptoms of hypoglycemia. And these are trembling and foggy thinking and hunger, cravings, all these that are connected with insulin resistance, actually, the signs of insulin resistance after eating. And especially these cravings are for sweets, or we often ask our patients if they want a sweet after a huge meal, and the majority says yes. It's not just because they have a sweet tooth, but it's because it's an actual need. They need something sweet to bring again their sugar up.
So we shouldn't be too harsh on ourselves sometimes when we think that we lack self-control and that it's all, in the brain. It's not always in the brain. I just wanted to move on and talk a little bit in more detail about nutrition and about, you mentioned carbohydrates and starches before. What are some of the foods that are typically, let's say, high in carbohydrates? I mean, we know that things like, the glycemic index, where foods are categorized according to the index, have been around for a while. And I guess each person is different, but I'm sure there are some sort of broad categories that we know, if not paired with the right foods, or if eaten on an empty stomach, or if eaten even when you're stressed. I mean, I've seen that certain foods, when I'm stressed, my insulin is better able to respond, and so I don't spike as much, but other times not so much. So it's all about experimenting and seeing what works for you. But what are some of those categories that are more likely than not to spike our sugar?
The typical foods that can create a spike are the ones that have refined carbohydrates, and it's the white bread or sugary things, or the foods that have carbohydrates in liquid form without without a dietary fiber, such as a fruit juice. And
That's a big one, isn't it?
these are the
Fruit juice.
typical
Sorry to
foods.
interrupt you, but fruit juice is actually a big one, as you say, because it is considered such a sort of health food and health drink. And in many ways it is, the vitamins are still there, but because you're obviously making juice out of this, you're removing the fiber. Can you just explain why it might not be the best idea to have that orange juice in the morning?
Yeah, because we don't take the fiber of the orange and we just have this juice. And this actually is a liquid form of sugar and fructose, and this actually can create a very acute spike. What can we do to avoid the spike is just have the pulp of the fruit in the juice, so that we can actually take some of the fibers that we would eat if we had the whole fruit in our glass. The best way to eat a fruit, though, is chew it, have it as a fruit instead of a fruit juice. Because imagine, in order to fill one glass of fruit juice, we have to squeeze 3 or 4 oranges. So imagine how more satiety you would have if you choose to eat 3 oranges or 4 oranges instead of sipping a glass of fruit juice, which actually you will drink it in 1 minute or even less time. So we want our meals to last a bit, to have carbohydrates in a non-refined form, as whole wheat bread, or in a form that it's not actually squeezed, or even the potatoes when we are having them baked is so much better than having them as pureed. So we actually don't want to torture food. We want to eat it as a whole, to give the time to our body to digest it and absorb it in a slower form. And in that way, we will have a less acute spikes. We will see an elevation in our blood sugar, but this would be less sharp and so much smoother than the spikes of a juice, for example.
I think that's an important point you're making because, it is normal for our blood sugar and our glucose to go up when we eat something. I mean, that's just what's meant to happen, right? So it's not something that should scare people, I guess, but I think it's important to differentiate a normal blood sugar response / elevation versus a spike that is something that does overwhelm us, right?
Mm-hmm. It's normal if we eat something that contains carbohydrates, such as bread or fruits or even vegetables, to see a small rise in our blood sugar. But this should be a bit flattened. It shouldn't be that acute, and in 2 hours' time, it should be back to the normal fasting levels. So we are expecting our blood sugar to go up, but then eventually to go up smoothly and down again to the normal, to the baseline that we actually started our meal. It's even reasonable and expected to see our blood sugar rises during exercise or after exercise, because we have some glucose stored in our liver and in our muscles. And when we start exercising without having a snack before, our body needs energy, and carbohydrates actually serve a role as a coin of energy for our brain and our muscles. And the stored glucose starts coming out. So if we measure our blood sugar during exercise, even though we didn't have a snack, we can see at some point that the blood glucose is slightly higher than the levels that we had before starting exercising.
But that's not it's not the same sort of, doesn't have the same negative impact on our body as a spike from food or something, sugary, let's say,
And it's not
right?
that
Like
acute also.
yeah, it's smoother, you mean?
It's not that
it will go
acute.
up, but
You can see a small rise. The food actually is providing us energy. Exercise is a way to burn calories, to take out energy. So the blood glucose follows a certain pattern, but it's completely a different mechanism behind it. So it's not bad to see sometimes our blood glucose rising a bit from the levels that we have when we are fasting. But the rise should be as flattened as possible and should return when we are not having something to eat at baseline levels, back to normal.
Right. And just going back to what we were saying about carbohydrates, and one of the things that I've read and seen in myself as well that can, let's say, blunt the glucose spike that often comes with consuming carbohydrates is pairing them with fats or protein, or having something that's high fiber, like a salad or something before you have that pasta, let's say. I wanted to get your thoughts on that and whether you could give us some examples or practical examples. And then the other question I kind of had is that fats are so often vilified, and we hear about zero fat and low fat and all these things, but correct me if I'm wrong, I think now the consensus is moving more towards a position where we understand that fats aren't evil, and that actually they are necessary if they're the right kind of fats.
Imagine that the Mediterranean diet, the percentage of fat in our diet should be about 40%, up to 40%. So the fat about a low-fat diet was actually coming from other countries than the Mediterranean Sea, following a very strict plan limiting fat intake. We have started actually identifying that having a very low-fat diet is not actually the best for us. What is important to see is the quality of fat. Not all the fats are the same for our body, and we should keep in mind that the majority of the fat should be either monounsaturated, for example, olive oil, or polyunsaturated, which actually is the fat from plants like canola oil or avocados, omega-3 from fish, and not saturated fat from meat and whole fat dairy and cheese. And in that way, we can keep a percentage of fat that is slightly higher, which is something that can help us lower the amount of carbohydrates that we are consuming, and also have the satiety effect of the fats, which is actually a very important role, and at the same time cover our needs in fat-soluble vitamins such as vitamin A and vitamin E, which are very important for our metabolism as well. And combining foods in the past was considered to be bad. For example, you probably remember diets that it was something like a sin combining pasta with meat, and carbohydrates should be separated from protein. But if we combine carbohydrates with protein, what we are doing is actually preserving protein for other functions than to produce energy. And the role of protein is to help us maintain our muscles and our strength, and not to burn it for calories. And this is actually a very important role of combining foods. Not only we can actually flatten the curve of glucose, but at the same time, we can actually maintain our strength and our good function of our body.
That's so interesting. I think my favorite pairing that I've kind of discovered is my morning, like an apple with peanut butter, which I've seen does wonders for not making my blood glucose spike. So obviously the healthy fats in the peanut butter, right? Or any excuse to eat peanut butter.
Peanut butter is protein and fat, and you are combining with carbohydrates and dietary fiber because you are eating the whole fruit. So it's, if we see it from the nutrient side, you have a complete meal, having all the three types of macronutrients together, and in a form that it is slowly absorbed.
True. And we spoke earlier about how two people may react differently to the same foods. And I think it's really interesting because people so often will Google, different diets, whether it's the
Mm-hmm.
ketogenic diet or the Atkins diet or the paleo diet, or, so
Mm-hmm.
many different things to choose
Yeah.
from. And
Mm-hmm.
actually, I've come to realize, and I think sort of what we've kind of discovered here at Sync and through developing, our product as well, is that each person reacts differently, and there have been a number of studies, you know, on our blog. I've written about, the study conducted by King's College London. There
Mm-hmm.
was another study at the Weizmann Institute that individuals react differently to the same foods, and actually even sometimes twins will react differently to the same foods. Can you tell me a little bit about why that happens, and what does it mean about how we should be thinking about the kind of diet we should be following?
Actually, the following years will be very interesting years in terms of finding out many things about how we react to different things, food included. So we started to realize that everybody is different, not only because he has different genes, but because he's actually carrying his microbiome. He's a carrier of other little organisms that actually play a huge role in different systems. Our gut is the second brain, and it functions in ways that actually we come to realize how important these roles are. One of these roles is how we digest food, and the way our microbiome uh, manipulates food is different to one another. And that has to do not only with what we eat, but also in what environment we grew up. And if we combine twins, again, we have the same. Most of the genes are the same, but every child has a different environmental effect. So we can see the combination of the same pool of genes, how they express, if they are found in slightly or less slightly different situations. And actually, it is very helpful to identify what is good for us and what is not as good as we thought even at first for us. And the technology helps us in a way to identify what is good and what is not. And continuous glucose monitoring is one way to identify what works for us and what is working in combination with other things. For example, we can see a food item working better when we are in vacations, where we are not stressed and we are not anxious for something. And then when we test the same food in working days or in full stress, we can see that it's not working as well as we were expecting. And in that way, we can make mindful choices about our food and our behavior in total and our way of life. So CGM is a great tool to show us what movements we can make towards a better metabolic health.
Yeah, I think it's incredible that you can also see it instantly. You get kind of real time visual representation of what your food is doing to you, in combination, of course, with other factors, as you said, whether you're stressed or not, whether you've had a good night's sleep or not, whether you've exercised, etc., etc. Can you just sort of tell our viewers and our listeners a little bit more, take a step back and sort of, so what exactly is a continuous glucose monitor? I mean, I guess when was the first time that, let's say, you came across it? And obviously it's kind of sort of until the last few years, it was primarily used by the diabetic community, for which of course it's invaluable, but now its sort of use is being expanded.
The first time I saw it, it was about 5 years ago for the management of diabetes, which actually it was something pioneer because the diabetics could monitor their blood glucose with having to pinch their finger. And imagine having a piano player having to pinch his fingers at least 6 times per day to measure the blood sugar, which is something that would interfere with his career. So it is something that actually makes the life of diabetics a lot easier, because you have just to scan the scanner and have a visual representation of the blood sugars, have the means, have the report of the day, and all this can be transmitted to the doctor and guide you towards a better regulation of your blood sugar. Now it seems that this technology is coming for other users as well. And this can be very useful for women in gestational diabetes, for example, or in women with polycystic ovary syndrome, where it is very common having hyperinsulinemia or insulin resistance. And in that way, we can actually see what foods creating the spikes and how we can regulate blood sugar so that we can manipulate our body weight and regulate our body weight in terms of polycystic ovary syndrome, which is a vicious cycle, because hyperinsulinemia is creating cravings. We keep on eating, so we are putting more weight. And if we don't do certain steps, we can't actually break this vicious cycle. And a CGM can guide us through the steps that we can take in order to regulate our blood sugar, so the cravings would be less severe and we could actually limit the food that we are taking and lower the body weight so we can actually have a solution. And in gestational diabetes, again, we're talking about a very fragile period of the woman's life. And the regulation of blood sugar is very essential for the health of the woman and the baby. So having a close monitoring without having the woman pinching her finger or having her measurements several times per day, not just 2 or 3, will give us the opportunity to have a more close and more acute and accurate control of her blood sugar. So the development of the baby and the regulation of her blood sugar will be more easy and more accurate.
Mm-hmm. Great. So just as a final question, I guess, and in a way to recap some of the things we've said, if you had to give someone, some basic sort of advice where to start from, because I'm a big believer that every little helps, and even small changes can lead to a big change in your lifestyle and your health. What would be some of your go-to kind of starting points for someone who's looking to just start sort of their journey to getting better metabolic health?
I would say that you should start from small changes that could be included in your everyday life and consider them a part of your everyday life. You shouldn't go on crash diets, because actually these are the diets that last for 2 or 3 weeks, and then you get tired, you get bored, you start craving the foods that you are not allowed to eat. And keep in mind that you can eat actually everything in the right portion, in the right time, in the right combination. We should make changes that actually are not putting our life upside down. We should focus on what makes us feel happy and what makes us feel healthier and more calm. Whatever makes us nervous actually is not doing us good, so we should keep it out of our lives. We have to find a plan that it is fitting better to our way of life. Include regular exercise, but again, in a way that is not stressing us, in a way that is giving us pleasure and not something that we are doing just having a pill. All of us, in some days, some part of our lives, were forced to do something that we didn't like. But again, I imagine how many times you stopped doing exercise because you didn't enjoy that type of exercise. And what we should keep in mind is that we should see our meals as a whole. We should try to mix all the macronutrients in a plate. And the guidelines, if you go along the internet and you check what form the current guidelines have, is something like a plate separated in sections where you can fit certain types of food in your plate. And this is actually what we should do. Keep in mind that we should eat some fruits and vegetables every day for the vitamins and the dietary fiber. Keep our meat and our dairy lean to avoid saturated fat, and eat carbs in moderation alongside with healthy fats. Drink a lot of fluids to keep hydrated and control also our hunger, because sometimes we feel thirsty but we don't actually realize our thirst and we believe we are hungry. And actually lead an active life in order to be metabolic active and metabolic healthy.
Great. Thank you so much. As you were talking now, I was thinking also about intermittent fasting, which I know you and I both practice. But I think
Yes.
that's, an episode on its own, and we can definitely
Yes,
talk
so we
more
will
about
talk.
that perhaps in our next conversation. Thank you so much,
Okay.
Liana.
Thank you. Bye.